Okay, so now we will take up this chapter of heavy metal antagonists. So you must have heard of compounds which are called as heavy metals, and these compounds are known to be dangerous and very poisonous in nature. So we have metals like arsenic, lead, bismuth, antimony, silver, gold, cadmium, thallium. All these are called heavy metals and they can be quite poisonous. They have a lot of harmful effects that they produce if they enter the human body. So if somebody gets poisoned by these heavy metals, then we need some drugs which will help to overcome that poisoning effect. So those kind of compounds are called as heavy metal antagonists. So the drugs used to remove the poisonous effect of heavy metals, we call them as heavy metal antagonists. Now in most of the cases, the drugs which we are using as heavy metal antagonists, they are chelating agents. That means they will have a lot of affinity. They will be attracted very strongly to the heavy metal ions, and by combining with that heavy metal ion, it will form a complex, and that complex which is produced will be non-toxic in nature. So heavy metal is toxic. The drug will combine with the heavy metal and form a complex, and that complex which is formed is non-toxic and it is water soluble. So because it is water soluble, it can easily get excreted by the kidney. So there are certain drugs like that. One of the most important drugs which we can use as heavy metal antagonist is the compound called dimercaprol. It is also called as British anti-leucite or BAL in short. Okay. Now this compound is a dithiol compound. That means it has two sulfhydryl groups. So what happens is these two sulfhydryl groups which are there in dimercaprol, they will bind with the heavy metal. So because the heavy metal has got bound up to these thiol groups, then it cannot go and block the enzyme sites and therefore it will not have the poisonous effect. So that is the advantage of this dimercaprol. It can be used in treatment of acute poisoning which is caused by arsenic, mercury, gold, antimony, bismuth and thallium. It has some side effects. It may cause nausea, vomiting, headache, tachycardia, that is increase in heart rate, and hypertension. It is administered parenterally. You cannot give it orally. Then another compound that is given is called as D-penicillamine. Now this is a monothiol compound. That means it has only one sulfhydryl group. And this compound is actually obtained from benzyl penicillin, which is one of the penicillin molecules. Now this is able to chelate the metals like copper, lead, mercury, and by forming a complex, it will allow that complex to be excreted from the urine. It may cause some gastrointestinal irritation, it may cause alteration in taste and some allergic reactions, but otherwise it is good for use. It is used to treat poisoning by copper, lead, and mercury. Then there is a disease called as Wilson's disease, in which the copper gets accumulated in the tissues. So to treat that condition also, we can use D-penicillamine. And sometimes it has been used in treatment of rheumatoid arthritis also. Then the next compound is calcium disodium meditate, and this is especially useful in chelating lead and other heavy metals. It will exchange the calcium ion. So this compound will give up the calcium and it will bind up the lead or other heavy metal ion. Now this drug also has to be given only parenterally. It cannot be given orally. Some side effects can be there, like it may cause fever, GI disturbance, thrombophlebitis. Generally, it is found that it is good to use this calcium disodium editate in combination with dimercaprol so that we can treat lead poisoning. Dithiocarb is another chelating agent. It is to be given initially intravenously and then we can give orally. And this also is used for treatment of Wilson's disease as well as for treatment of nickel carbonyl poisoning and acute thallium poisoning. The last compound in this list is diethylene triamine pentacetic acid, which is used in acute iron poisoning. So when somebody has toxic levels of iron which accumulate in the body, then we can use this molecule to treat that poisoning. So the next topic we will go over is the study of certain drugs which act on the uterus. And these drugs are called as oxytocics or ecbolics. Okay. Now you are aware that the uterus is the part of the body in the female where the fetus grows to term. And at the time of labor, there has to be contraction of the uterus to allow that fetus to be removed out of the body, to move, to be expelled out of the body. So we know that there is a hormone called oxytocin, and the function of that oxytocin hormone is to stimulate contraction of the uterus. So any drug which has an action similar to that of oxytocin, the drug which has action similar to that of oxytocin is called as an oxytocic, or it may also be called as ecbolic. So these are the drugs which stimulate uterine contraction so that the contents of the uterus, whatever is there inside the uterus, can be expelled out. Now, to classify these drugs, there are two categories. The first category is what we call as direct ecbolics, means they will directly act on the uterus and stimulate its contraction. So that includes compounds like the ergot alkaloids and posterior pituitary extract. And then there are some drugs which don't act directly on the uterus, but they will cause irritation in the area around the uterus so that by an indirect way, the uterus also is stimulated and it will expel its contents. So those category of compounds are called as indirect ecbolics. So certain purgatives which have very drastic action, then some local irritant molecules like cantharantin, all these can be used as indirect ecbolics. But because their action is unpredictable, they are not used in therapy. So it's only the direct ecbolic compounds which we are using in therapy. So we will see a little more about some of those important drugs. We have ergot. Ergot, as you remember, we have studied in pharmacognosy last year. So this ergot is obtained from a fungus called Claviceps purpurea. This Claviceps purpurea fungus grows on the ovary of the rye plant, and that fungus contains some very important alkaloids, histamines, and steroids. Now, it is important to remember that this ergot, it can have two forms, levorotatory form and dextrorotatory form. Only the levorotatory form of the ergot is having pharmacological activity. So we classify these ergot alkaloids into three categories. There is first category which is called as amino acid alkaloids. For that the examples are ergotamine, ergosin and ergotoxin. The second category are the compounds which are dihydrogenated amino acid alkaloids. So the example for that is dihydroergotamine, which is also called as hydergine. The third category are the amine alkaloids, compound called as ergometrin or ergonovin. This is the example. Now, these ergot alkaloids are used, as the name indicates, we are saying they are oxytocic in nature. So, because they are oxytocic, that means they will cause contraction of the uterine smooth muscle. But what happens is that the action of this ergot is such that it will cause contraction, but there is no relaxation after the contraction. Now, at the time of childbirth, during labor, we want an oxytocic agent which is going to cause first contraction, then relaxation, so that the baby can be expelled out smoothly. But ergot does not have that property. It will only cause contraction and not cause relaxation. That is the reason why it is not used to induce labor, but it has some other uses. And it is an adrenergic blocker drug, and it has direct vasoconstrictor activity. It will cause vasoconstriction, and it has the ability to antagonize or to oppose the action of 5-hydroxytryptamine. So these ergot alkaloids are not used for inducing labor or to induce childbirth. Instead, we use them for certain other purposes, like um, after the child has been born, there will be some amount of blood loss that is called as postpartum hemorrhage. So to prevent too much of blood loss, we can use ergometrin and methyl ergometrin as prophylactic or for treatment of postpartum hemorrhage. Then second thing is we can use it also to hasten the uterine involution after childbirth. Now once the child has been born, that uterus will have become kind of loose and it will, have moved slightly from its position. So you want it to come back to its original position by contracting. So for that purpose also we can make use of ergot alkaloids. Then these hydrogenated derivatives, no, which we talked about, that compound which we said is hydrogen. So that compound can be used in treatment of hypertension or high blood pressure. Then ergotamine as well as hydrogen are both used for treatment of migraine. So they can have some important action against migraine headache. So the adverse effects of these ergot alkaloids, they can cause nausea, they may cause meiosis, which is constriction of the pupil. Sometimes it can cause postural hypotension, that the person's blood pressure will drop when they are standing up. Then it can cause tingling and numbness. In some people, it may lead to gangrene because too much vasoconstriction has taken place. Then they may have headache, drowsiness, and confusion also. So ergot is an ecbolic or oxytocin drug, but it is not used for inducing labor. Oxytocin is the other compound, and that is very useful to induce labor. It is the natural hormone which is produced in the females. So this oxytocin is a polypeptide. It is made up of 9 amino acids and it is secreted by the posterior part of the pituitary gland. Now the pharmacological action of oxytocin is that firstly it increases the tone and amplitude of the uterine contraction. So it will increase the contraction of the uterus and its action will be such that it will cause contraction followed by relaxation. And secondly, it promotes the expulsion of milk from the mammary glands. Now this oxytocin is to be administered by intramuscular injection. It is used to induce labor. So if the woman is about to give birth but the pain is not strong enough, then we can give oxytocin so that it will induce more and more contraction of the uterus by which the child can be born easily. Then it can also be used to control postpartum hemorrhage and it can be used to promote the milk product ejection out of the mammary glands so that the child is able to get enough quantity of breast milk from the mother. There can be some adverse effects of this oxytocin. It causes water retention if it is given intravenously. And if if the doctor does not use this properly, then it may cause premature birth and sometimes fetal death also. Because if it is injected at the wrong time, then the amount of contraction and other effects that the oxytocin produces will be such that that fetus may be born prematurely before it is due for delivery. And also the fetus may die if this drug is not properly used. So it has to be used with a lot of care. Next set of compounds are the prostaglandins. Now these are C20 fatty acids. They are having an important role to play in inflammation and these also have the ability to stimulate the uterus and cause contraction. They have many other actions also. They reduce the secretion of the progesterone and because of this, when progesterone is not available in sufficient quantities, then the fertilized ovum cannot get implanted in the uterus. So because of that, sometimes it is used as an abortive drug. It can be used to abort the fetus. At the same time, because it is having ability to stimulate uterine contraction, if the pregnancy has continued to term and it is time for the child to be born, these prostaglandins can be used to induce labor also. Then hypertonic saline, that is saline whose osmotic pressure is higher than that of blood. So hypertonic saline can be used to cause uterine contractions and when this saline is injected parenterally, it in large doses, hypertonic saline when it is injected, it will damage the placenta, and because of that there will be fetal death. So it was being used in the past also to cause abortions. Then we have certain drugs. All these whatever we have seen so far, they are all the drugs which are having uterine contraction property. Then there are some drugs which are having the opposite action. They will cause relaxation of the uterus. So they are called as uterine relaxants. These drugs don't have much therapeutic value, right? Only they can be used that suppose sometimes the woman goes into premature labor and the delivery is going to happen fast before the fetus is fully matured, then we want to avoid that situation. So to delay the delivery in case of premature labor, we can use these drugs which have uterine relaxant property. We said that if uterus contracts, then the fetus will be expelled out. So if the uterus is in a relaxed position, the fetus will not be moved out of the uterus. So that is the reason why we use these drugs. Orsiprenalin, salbutamol, isoxsuprine, halothane and relaxin are some of the agents which we use as uterine relaxants.